minutes. The Premier will be up shortly. Good afternoon. Who's counting again? The Premier, the Honorable David Burt, JP.
4, 3.
Good afternoon, ladies and gentlemen of the media. The Premier, the Honorable David Burt, JP, MP, will give an address to the nation. Thank you.
Members of the media, good afternoon to the listening and watching public. Today, I'm joined by the Minister of National Security, the Minister of Health, the Chief Medical Officer, also the Commissioner of Police, and the Acting Commander of the Royal Bermuda Regiment. Good afternoon. Today, I will start with a COVID-19 health update and then provide some context around the national address, which I'm sure that most persons have been able to listen to that I gave earlier this afternoon. Minister Keynes will discuss the results of the meeting of the EMO earlier and will also provide details of the operational aspects of the shelter-in-place measure, which was announced earlier today. Regarding COVID-19, I can confirm that there were 8 results that were received today by the Ministry of Health, and there are no additional positive cases to report. Our total number of confirmed cases remains at 32 persons. As I mentioned last night, there were 3 cases that were under investigation. 2 of those cases, which were under investigation, have been confirmed as close contacts, and a 3rd remains under investigation still. As of this afternoon, there have been 236 tests that have taken place, and there are 33 results which are still pending, 171 negative results, and as I mentioned before, 32 confirmed cases. Out of those 32 confirmed cases, 20 were imported, 11 were limited local transmission, where we could trace the contacts, and 1 is still under investigation. It is important to note that 10 persons have fully recovered from their infections, while 3 remain hospitalized in stable condition. We currently have 1,488 persons who are under self-quarantine with public health supervision. Earlier today, I gave a national address stating that from the 4th of April at 6 a.m., Bermuda will implement a shelter-in-place measure for 14 days. The shelter-in-place is scheduled to end on April 18th. The decision to move to shelter-in-place was not taken lightly. We looked at the number of confirmed cases in Bermuda. We listened to the guidance from the Chief Medical Officer, who is closest to the situation. With COVID-19, there is uncertainty, and decision-making is tough and will always be second-guessed and will always be questioned. I recognize the incredible pain that this will cause in our community, both financially and certainly emotionally, and how unpopular this decision may be in certain quarters. However, the pain will be nothing compared to the pain that we will have if we have an overwhelming of our healthcare system, which will lead to a number of deaths. We have seen it play out on television overseas, and it will be a violation of our public duty if we do nothing to prevent that from happening here. This government will always make decisions that are in the best interests of the health and welfare of those of us who live in Bermuda. So what does shelter in place look like in practical terms? It means that the only businesses that will remain open are food producers, such as farmers, fishermen, and those persons who raise and herd livestock, food wholesalers, retail grocery stores, doctors' offices and medical facilities, pharmacies, gas stations, the ports, utility companies like gas and water will be available for emergency service, and banks on restricted hours to only provide the most essential of services. Local banks have been designated as essential services. However, all face-to-face interactions between bank customers and bank employees will be suspended for the 2-week period. Bank office operations include the servicing of ATM machines and the processing of wire payments, among other things such as online banking will continue. The purpose of this 14-day shelter in place is to restrict the movement of people to ensure that our healthcare system is ready for any future surge in patients. It is a big step to ask persons their properties, to close beaches and public parks, but it is essential that we restrict movement to ensure that we contain and constrain any possible outbreak. People will be allowed to exercise outside of their home within reasonable distance with no more than groups of 2 for restricted times. Minister Keynes will provide additional details when he speaks, and the police commissioner, as well as other officials, are here to answer any further questions. It is essential that we remember that this is a time that we must all pull together, and we must all do what is right for ourselves, for our families, and for our communities. We must work together and treat each other with kindness and respect. There are a number of stories that have come to me regarding landlords, both commercial and residential, who are not understanding the need for compassion during this particular time, and who are demanding rent from those persons who have been let go from work and are threatening eviction of people who, from no fault of their own, can operate their businesses and cannot pay the rent on their home or their apartments. To these unscrupulous landlords, I say, today, the courts are closed and eviction notices will not be processed. This is a time for unity, and it is not a time for us to turn on each other. I want to touch on the airport and when it is scheduled to reopen. We closed the airport to schedule commercial traffic for 2 weeks, commencing on March 20th, 2020. The fact is, however, that due to the global situation, we have been informed that there is no commercial air carrier that has regular service to Bermuda that is intending on recommencing flights until May 1st, 2020. It is important to note that this is not fully a decision of the government of Bermuda, but also of the air carriers which are flying. This does not prevent our efforts to continue the work to bring stranded Bermudians home and ensure that there are adequate quarantine facilities in which to house those persons to minimize the risk of any future outbreak. Before Minister Keynes comes to the podium, I want to remind people that you have time to get your home in order before shelter in place goes into effect on Saturday morning. You do not have to run out and start panic buying. Remember, grocery stores will open during the 14 days that we will be sheltering in place. And in addition to that, all major grocery store chains have confirmed that the traditional Wednesday 5% discount will be in place during the entire duration of the shelter in place. I want to thank the employees of our grocers who are doing stellar service while they are on the front lines. Our ports will be open for goods, and goods will continue to come to the island. If you run out of necessary items, you will still be able to purchase them. So I will encourage you over the next few days to operate and do things in a good and decent order. We have the opportunity to show each other our best, to be our best, and we must show kindness to each other and exercise the patience of which this time requires. While we cannot touch or hug each other, we can share a smile, exchange a warm greeting, check up on your friends, possibly repair those relationships from a distance which have been frayed, and go the extra step to be a friend, because that is the only way that we will get through this tough time together. I will close my remarks by saying I want to again pay tribute to all of those persons who have answered the call of service. I was particularly gratified that after my press conference yesterday, I received WhatsApp notices from public officers who made sure that they prepared themselves to drive nurses to the hospital earlier today. This is a time when we can all come together. As I said earlier, COVID-19 does not discriminate based upon age, does not discriminate based upon race, does not discriminate based upon economic status, does not discriminate against political party, and does not discriminate against immigration status. If there was ever a time when it was about all of us being in this together, it is now. I recognize that the times will be difficult, but I will call upon all aspects of society to not only ensure that we endure this next painful period, but we write the next chapter of Bermuda's history, which will be one of success collectively as we seek to recover from the damage that this crisis right now will cause, but certainly will not have to endure if we do what's necessary and right. Thank you, and now I will turn the podium over to the Minister of National Security. Minister.
Thank you, Premier. After a meeting this morning of the Emergency Measures Organization's operational subunit, the following was decided. We would like to highlight that a state of emergency allows the population limited movement to conduct essential tasks. Any departure from their property, from a person's property, can only be to purchase goods or for the collection of essential medications. There will be a 24-hour shelter in place from 6 a.m. Saturday, April the 4th. Persons who are confined in their places of residence during the 24-hour must be confined in their places of residence for the 24-hour shelter in place. The time period will be reviewed and may be extended. Although comprehensive, it is not exhaustive, and the procedure for someone to apply to leave to their residence will be outlined. The protocols will change as the Governor and the Cabinet review the situation in consultation with the Chief Medical Officer. During the times of essential movement, everyone must practice social distancing of 6 feet between persons. There will be limited movement during the day for essential tasks. Persons will be permitted to exercise by foot, no more than a half a mile from their properties. Exercise should be only in groups of 2. Beaches and parks will be closed. The people below are exempt in accordance with the law. The Bermuda Police Service, the Royal Bermuda Regiment, the Bermuda Hospital Board employees and their essential contractors, emergency medical services, the Bermuda Fire and Rescue Service, the Bermuda Customs Department, the Bermuda Immigration Department, the Department of Corrections, the Disaster Risk Reduction and Mitigation Team, medical and paramedical professionals, pharmaceutical companies and pharmacies, caregivers, nurses, orderlies, doctors, clinics and pharmacy workers, private doctors, veterinarians, public media services, radio stations, social media, cable companies, newspapers, and interpreters. Alathwaite International Airport services provided to Skyport and their contracted agencies. Balco, dock workers unloading and loading cargo ships, including the trucking regime that supports the aforementioned. Licensed private security guards. The removers and handlers of deceased persons. The Ministry of Public Works, Waste Management, and Water Treatment Plant, and all the supporting departments and contractors for the collection of storage, the treatment and disposal of sewage and garbage. Telecommunications providers handling landline, cell carriers, and radio communications. Brokers and shipping agents. Financial institutions and ATM service providers. Fuel distributors and gas stations. Farmers engaged in agriculture and livestock, fishermen, food distributors and supermarkets, restaurants for takeout service only, and food delivery services, collections, and delivery from registered voluntary and community outreach programs. In other words, restaurants will be open for takeout only, and only food delivery services, such as Sargasso Sea, will be allowed to make collections. Authorized government shelters, critical cleaning services, and sanitation workers. Hotels, villas, and ancillary staffs. Please note that game rooms, spas, gyms, tennis courts, and any other recreational services provided by hotels are not allowed. In-room dining only. All courts will function under the guidance of the Chief Justice and the senior magistrates. Again, persons must remain in the confines of their home during the curfew period. Churches, closed. Funerals should be conducted in cemeteries with a maximum of 10 mourners. Weddings are suspended. No social gatherings whatsoever. The general public are not permitted in areas designated as quarantine centers or homes where persons are under self-quarantine. Prisons are closed to visitations. All schools remain closed until otherwise advised by the Minister of Education. Visitation to senior citizens' homes are not permitted. Visitation to hospitals are limited to essential visitation only. The purchase of groceries, they should be performed by one member of the household to minimize social interaction. Groceries should not be bought more for a period longer than 7 days. Individuals perceived to be purchasing in bulk or excessively will be challenged and potentially not be able to purchase the aforementioned goods. Groceries should only be purchased at the nearest available store to the family home. In other words, if you live in Somerset or Bowes Island, you should purchase your groceries in the West End. That goes for the middle parishes and the Southampton parishes, as well as the central and the eastern parishes. You will be advised to purchase groceries in your area. All recreational spaces, including beaches, parks, and etc., will be closed to the public. Again, the public should remain in the confines of their home and garden areas unless it is to travel for the matters that we specified earlier in the statement. Community advisory points will be operated by the Bermuda Police Service and the Royal Bermuda Regiment, and will be in operation across the island 24 hours a day for the 14-day period. Pedestrians and vehicles will be stopped to ascertain the reason for them being away from their homes. Unless it is for essential travel, as specified, or you are an essential worker, your names will be recorded and you will be directed to return home. Repeat infringements will result in the consideration for your arrest under the appropriate legislation. Bermuda, these are some very challenging times. We believe that we can get through them together. You might be alone in your home, but we are in this together. Thank you.
Before there's any questions, I'm sorry, Minister of National Security.
Thank you very much. You mentioned that there had been some of the public officers had reached out to try to offer assistance to healthcare workers today. Are you, I guess, any further forward with minibus services that can take that on a more longer term basis, or is there an opportunity for other members of the public to offer the assistance? Is that something you would consider?
I'm hopeful that the situation regarding transportation can be resolved, and I'm certain that that work has been ongoing. I have not received the latest brief. What I'm saying is that in a spirit of making sure that we step up to the plate, there were public officers who have access to government-owned vehicles, which were not private minibus services, that made sure to accommodate those persons to getting our nurses and healthcare workers to the hospital early today, and I just wanted to pay tribute to them.
Sure. And with regards to healthcare workers, hearing some reports with regards to perhaps members of staff at the hospital that either have been infected with Covid-19 or are being tested for it. Can you confirm any of that?
I will happily hand that over to the Minister of Health.
Certainly.
Thank you. For obvious reasons, confidentially, we're not in a position to disclose who has or has not been tested. I think what's important to note is what the Premier has previously indicated is that we are testing quite rapidly. There are 32 confirmed cases. 8 results came through today that were all negative, but for obvious reasons, living in a small community such as ours, we need to maintain persons' confidentiality so that they can continue to have confidence in public health. And if I could just add one more thing with respect to the closures that Minister Keynes indicated, with respect to the hospital, it is closed for all visitations, save for end of life.
Thank you very much.
Thank you.
Thank you.
Question. How are you going to monitor? How are you going to monitor for those that are traveling and they might say they're going to the store, the pharmacy, etc.? You're going to really the honesty.
Here's the thing, Trevor, and it's a very simple thing. The police have, Police Commissioner, do you want to speak to that? Go ahead.
Trevor, I think what we've got to reflect on is what's taken place already. The community advisory points have worked successfully with the public, and we are seeing a level of engagement and actually a significant reduction in the number of vehicles on the roads. Of Tuesday last week, we recorded over 1,000. By Thursday, it was down to 250. So the message is getting across. This is about working together, so we trust our community to work with us. So if there are elements of dishonesty, then we've got the powers to deal with that. And Bermuda police officers do know their community. They know people, they're able to engage. So I am extremely positive around the fact that this will work. We're seeing it working within the curfew